I know being on both sides of the coin, when I was diagnosed, I was not a scientist at the time. And then, graduating and now talking to my doctors, it's very different. So, for the average patient, it's very difficult for them to present doctors, hey, can you profile my tumor or my blood? And, half the time they're not sure what quite they're talking about. So doctors maybe don't take them as seriously. And so it's unfortunate. But what advice would you give patients that want their tumor profiled, to know which biomarkers they could have that could be treated, but it's not covered by standard of care, but they want to still go ahead and see the results of that?
And one thing I would say for the patients, Susan, is that, sometimes people get really scared and stressed because the complexity, oh, what is this genomic profiling? What type of test? What do I need to get? And I always say, you don't need to be, you don't need to have a PhD. You don't need to be a genomicist. You just need to really, at a high level, be aware that they can do an analysis of the DNA of your tumor. They can do an analysis of the DNA of your blood, and that can help you really guide your diagnosis and your treatment. But I'm also super surprised. I'm in a couple of, for good or for bad, Facebook forums. I don't recommend these, but they're
They're
I
still
found it,
helpful. Yeah.
in a way, is helpful because I don't know that many women with breast cancer. I only have two close friends or people close to me that I could ask questions. But a lot of the questions you have about your side effects of chemo, these groups are like, phew, there's all kinds
Yeah.
of good information, all kinds of crap information, all kinds of
Yeah.
scary things, but also, so I use I actually, I was curious to know if this woman in because I'm in a group in the US or more global, and another one that is just Canadian. So I ask the questions in both. I share my story and I say, well, I got my profiling of my tumor with Oncotype DX and I got the hereditary cancer panel. I wanted to know if those women, in a way, knew the difference between the two, if they, or if you just say, because I remember asking friends if they got any genomic testing out in Colombia, and all of them will talk about the hereditary cancer panel. None of them will talk about the profiling of your tumor. So that indicated to me that people are not giving the option of profiling your tumor. Whereas in the groups, in the Facebook groups in Canada, I was surprised. People knew about their Oncotype DX or MammaPrint. They
Hmm.
knew the scores. They knew when they needed chemotherapy or not. They were, people start reading. I mean, and it's at the end of the day, you get an amazing team for your care in oncology. You get the oncologist, you get the surgeon, you get the radiologist, you get the nurses. But who is putting all these dots together? Is you,
Exactly.
is the patient.
Yeah.
Because they
Yeah.
all get pieces and bits of your
Yeah.
story. The
Yeah.
only
And they're
one,
they're busy, they're seeing many patients, and yeah, you have to be
exactly.
your own advocate, and that's the first thing I tell patients. And some patients don't want to hear that. They want to just put it in the hands of their doctors, which is fine, but if you have a difficult disease, or if you want to ensure that everything's getting checked off, you have to be your own advocate, and you have to go out and get that information out there. And
Exactly.
for myself, I was the one that found this phase 1 trial, and I know most phase 1 trials don't, that was the Gleevec trial, that most of them fail, and that's what my doctors told me. They said, no, you don't want to be a guinea pig, it's going to fail. So I had to contact the doctor in charge of that clinical trial in Portland, Oregon, and that's where things started from there. But yeah, so it's, that's a lot more than patients usually have to do, but being educated about your disease is really important, and to ask the important questions to your doctor.
Exactly, exactly. And as you say, Susan, your oncologist sees you 15 minutes, 20 minutes.
Exactly. Yeah.
And well, we're lucky that they see us frequently, but it's 20 minutes, it's 15
Yeah.
minutes, and you manage to say so much in those. So I always say, be prepared, read, get the information, ask. Don't be afraid to ask. And the other thing, and I speak as a medical doctor myself, doctors are humans. They also make mistakes. They also forget.
Exactly. Yeah.
They don't
Yeah.
have in their brains all the information. They are not artificial intelligence machines
Yeah.
that have all the
Exactly.
information right in the fingertips. So it's only you that will be able to tell them and say, what about this? What about that? And don't be afraid to ask several times until you get, or don't be afraid to go see somebody else. I have full trust in my oncologist, full trust. I really, think she got everything. She's really at the cutting edge. She has the knowledge and everything. But even though I trust her 200%, I went to consult two other oncologists to
Wow.
see, did
Not
I
not
get.
many patients do that. Yeah. Because you don't want
Yeah,
to insult your doctor and you're scared to do that, but it's your life, right? So,
it's
and you
your
need to,
life.
even if you just feel confident that, okay, I'm getting the right treatment, you
Yeah.
should do that. Yeah.
I would say, in my case, second opinions, because I trusted my oncologist and I trust my oncologist. In some other cases, and I share a story about actually another woman from Latin America, from Dominican Republic, and I've heard that story. That's an example of a story I've heard already several times. Unfortunately, is a sad story. But this is a woman that detected a lump in her breast, went to the family doctor, and the family doctor said, this is nothing, and sent her back home and didn't send a
Wow.
mammography. And of course, you trust your doctor. You say, okay, if the family doctor says nothing, it's nothing.
Yeah, and you
I
and you want to
remember,
feel like it's nothing. You're like, oh, okay, good. I'm
you know
relieved.
what? Exactly. You
Yeah.
want
Yeah.
somebody because your brain is
Yeah.
saying it's nothing. And I remember my
Yeah.
doctor initially say, well, there is 99% probability that is nothing. And this lump, she say, I remember in my case, is not really attached. And and I say, well, I think it's attached in my perception. Maybe I'm wrong, but I think it's attached, and I'm really scared. So, I think my doctor from the get-go, my family doctor, was planning to send me to a mammography, but I did push also on my side and say, I really want this to, we need to look at this woman, Doris, that I wrote the blog about, went to see three family doctors. And at one point, with the third one, she already had family history. She had a lump in her breast with an aunt and a sister with breast cancer and still didn't get a mammography in BC.
Incredible.
This is
Wow.
not in, Africa. This
Yeah.
is in Canada. This is in British Columbia. Yeah, she was on a small remote town, but
Okay.
regardless,
Still. Yeah.
everywhere, you should be able to get your diagnosis. So I think don't be afraid also as a patient
Hmm.
to, in a way, question or challenge or go and look for second opinions. And if you're worried, because in her case, she had pain, she had really changes in the skin. So she had all the signs and she was really
Yeah.
worried, and yet
Yeah.
not getting a referral for the mammography. So I think it's important. We are now in the times where, doctors are always, brilliant and really a critical component of our healthcare system. But I think patients really are at the center of everything we do at the healthcare system.
Exactly.